am here to learn about the respiratory therapy program.
Well, I can tell you a lot about the program. The respiratory therapy program is a 3-year program with the first 2 years based here at SAIT with classroom, lab, and clinical site practicum visits. The third year of the program is composed of clinical practicum based at hospitals in southern Alberta.
What kind courses and labs make up the program?
The courses focus initially on basic knowledge and skills. Knowledge like anatomy and physiology and patient assessment skills such as learning to take a blood pressure and auscultating the chest. As classes progress, you will learn about different pathologies such as chronic obstructive pulmonary disease known as COPD and asthma, for example. In labs, you will learn how to initiate and monitor oxygen therapy and how to manage patients who cannot breathe for themselves and require assisted ventilation with a mechanical ventilator.
That sounds interesting. I've heard something about a human patient simulation lab. What can you tell me about that?
I'm glad you asked about that. The simulation lab is a very realistic hospital environment where we have robotic patients that are very lifelike. They talk, have pulses, breathe, and present with a variety of medical conditions. As a student, you can practice your interview, assessment skills, and perform many medical interventions such as starting oxygen therapy or even intubating the patient to put them on a ventilator to take over the work of breathing for them. It's a very realistic learning environment that is safe and fun. Students really like spending time doing the simulations.
Wow, that sounds like a great way to learn.
It is. If you like, you can attend the SAIT online open house on October 27th and talk to one of the instructors who can tell you more about the program.
Thank you. I'll go online and sign up for the open house. Thanks again.